Hello, this is your overview for the Dexter's Lab pre-course content. By now you've managed to get to Moodle, and just as a kind of a quick reminder, when you get to the Hopkins webpage, Johns Hopkins Lifeline for your Moodle site, log in up the top. You want to log in with your JHead credentials, and it would ask you to put the credentials in. And then finally, you've already gotten to this point with Dexter's Lab pre-course content. I wanted to take this opportunity to introduce you to some changes in how we're doing Dexter's Lab this year. Obviously, you can see there's a large part of the pre-course content done on Moodle, and I'm looking forward to your guys' feedback for how this is received. In addition, we do have some requirement changes for this year. You need to print out your waiver and sign your waiver, bring it with you. That's your ticket to ride to get in. You need to have your waiver with you in class. Please print out your waiver, bring your waiver to you in class. Lifeline skills tracking sheet is the other thing to print out. This tracking sheet as well, you will keep track of the skills. Nurses and medics have a requirement for 50 intubations plus a successful airway simulation, and we'll talk about that grading. The other things that you're going to want to bring with you is a laptop, a tablet, or a smartphone. You're going to need this to be able to complete your post-course evaluation, as well as to enter your skills log that you've done on pencil and paper, or pen, however you choose to do that. So please have your paperwork available and have a pen available with you. Location is listed here. Google Maps will take you directly to their location. It is a bit of a challenge for those who are first timers in getting there. It's buried well in the back of a business complex. You'll find the lab schedule as well as the course announcement there if you need to have that available. With regard to course requirements, so nurses and medics need to have 50 successful intubations. From prior courses that I've collected data, 50 intubations is more than manageable. We're going to have 5 stations. Each station will have 45 minutes. Each cohort will have a mix of nurses, medics, EMTs, as well as guests. Which essentially brings down to 10 intubations per station, more than manageable for 45 minutes. And being that you'll have roughly 5 in a team, we should be good to go. In addition to the successful intubations, as far as the number, there also is a airway skills station. The skills station will be assessed with the following criteria. It will be both a qualitative and quantitative grading for this. You will need to state what your plan of care is for airway management. You'll need to choose the proper tools and employ the proper techniques for managing the airway. You'll need to be able to effectively use those airway tools doing that airway simulation. And then with that, you'll need to have good communication with the person that you're working with. To support this, Lifeline Skills Lab is open and available for you to practice your airway management needs, and all tools will be made available. Please do not come to the airway lab without having at least practiced a handful of times with the different techniques. This can be done during downtime and will only take a few minutes. The paperwork that you need to have with you is right here, the Lifeline Skills tracking sheet that we talked about. You want to make sure that that's available, as well as the waiver. I have some general course material that's in here for you. If you love the Mac Bleed, it will let you down sooner or later, and so some things to keep in mind, some videos to look at there, as well as for the Miller Blade. Those that can use the Miller Blade will look cool and be rock star and deities to their peers, especially when you can do it under pressure. With regard to burp or external laryngeal manipulation, we have some additional information there. You'll see a video as well as the Cormac grading scale for your perusal. And then for $3.50, we have a life-saving tool, bougie or the tracheal introducer, and some key pearls for its use, as well as a video for as a primer. We have additional information about positioning, and this is probably one of the biggest challenges we have in EMS. in pre-hospital care is because we have such an imperfect environment, but you get the head up into the air, whether you ramp it up or you pick it up, ears to the sternal notch, and you can improve the airway grade by 2. We have a comprehensive review on how to set up the King Vision and insertion techniques, as well as some considerations for turning the endotracheal tube and the bougie. There's a section for bougie-assisted cricothyrotomies, and this will be the technique that we are continuing to train. And with that, there's a video to help kind of support that. And the picture here, please study it for the landmarks. We have the easy IO material to review. You'll find the insertion for both proximal humerus and proximal distal tib, as well as a video which demonstrates 6 big mistakes that you can make with an IO. This video is not for the faint of heart. I will warn you for that one. Post content will be posted on the day of your Con Ed time. You will get 2 hours of credit for completing the material pre-content, and there'll be 2 additional hours for post-content. If your post-content is not done within 24 hours, you will not get credit for it. Post-content must be done within 24 hours to receive credit. Last but not least, I have an article to outline an approach to the physiological difficult airway. This is a optional supplemental kind of material. I hope you enjoy it. It's a little extra nugget for you guys to get a leg up on airway management. Remember, Lifeline Skills Lab is open and available. Please do not come to this session without being prepped, both with this material that we have posted here for you, as well as the hands-on material. We want to make the most out of this. Lastly, anatomy gift registry, some things to think about. The patients that you will be working with have all elected to be here. This is not a situation where this was a last-minute decision. This was a decision by patients well in advance to help further your training. With that being said, we want to be respectful of the donation. We want to maximize the amount of learning that we can get for this opportunity. It's really important. So, with that being said, last thing to consider here is just kind of lab safety. Each of the cadavers have been completely screened. There are no infectious diseases. Each of them have demographic sheets for you guys to take a look at. And the history is also available to that. And I look forward to seeing you guys there. If you have any questions, feel free to give me a call, send me an email. Well, don't send me an email. Give me a call, give me a text, or just see me in the hallway. Take care. Signing off.